Zoom recording. Fantastic. Okay, so the thing that we've got up on the screen right now, if anyone has ever used Mentimeter before, basically if you go to that, if you go to www.menti.com and you use that code, or I've got a link which you can follow on any device, you can start putting in 3 health and climate change challenges. Oh, we have someone who can't hear. 3 health and climate change challenges facing Manchester, and this is what happens when you try and paste things at the same time as doing something. And that will kind of automatically create a word cloud with everyone's contributions. So I've got something nice to look at in the background. And it's all part and parcel of the experience to be struggling to paste something.
Hannah, are you pasting the link to that in the chat? Try. Oh, there you go.
So it's what happens when you switch from a MacBook to a laptop 3 times in one day. You end up Control Ving, then Command Ving, and then just getting totally confused. Oh, we're coming in with some really great suggestions straight off the bat. That's amazing. All right. Since we're recording, we might as well just kind of get cracking. David, it's either. So you can either respond about Manchester City or Greater Manchester, or things that are kind of happening globally that really affect either of those kind of scopes, whatever you fancy, really. And I'm just struggling to get my computer to listen to me. Great. Okay, I will get cracking then. So hi everyone, thank you so much for coming today. As you can see, I'm Hannah. I'm delighted to be joined today by a lineup of wonderful speakers from Manchester and beyond to talk about climate change, its effect on health and social care systems, and what we can do about it. So a couple of quick housekeeping points just before we start. So as you'll have noticed on the way in, or from watching me like awkwardly suggest it, we're recording this session tonight, and we'll send out a little recording afterwards to everyone who signed up, so keep an eye out for that. If you could stay on mute throughout the session, that would be amazing. We've got the chat totally enabled, so feel free to use it however you want. You could maybe introduce yourself to someone new. And we've also got some interactive bits as we go along, like this little Mentimeter up right now. We're going to have a little question section at the end of the speakers. So if you want to post questions in the chat as you go along, we'll kind of collate those and make sure that those get to the speakers. And of course, finally, if you could all be respectful to each other and our speakers in the chat function, that would be amazing. You know, we don't want to have to like kick anyone out. We're all here to have a nice time. So yeah, now we've got those few things out of the way, let's kind of get on with the session. So what we're going to do is we're going to hear from each of our speakers in turn, and then we're going to open the floor. And then after that, we'll have a summary of our health and the climate crisis report, which you'll hopefully have got into your inbox at some point today. This event is hosted by Climate Emergency Manchester. If you've not heard of us, we were first set up in 2019. We're a group of local folks that are doing what we can to improve the city's response to the climate crisis. Over the last year, we've been working on something called Team Scrutiny. And what that means is we've been watching and reporting on Manchester City Council scrutiny meetings to understand where and how climate change is scrutinised across all of the committees. We communicate those conversations to a wider public audience, and kind of, you know, I think what we're doing here is oiling the wheels of democracy. Tonight's event has specifically come out of that work, as some of you will know, because you're on the Health Scrutiny Committee. Tomorrow, the Health Scrutiny Committee will meet to discuss climate change and health. To help understand how climate change and health intersects, we've got this wonderful lineup of people to talk about their personal experiences and reflections. So let's just jump straight into it. The first person we've got today is Sinead Millwood. Sinead is a Manchester GP based at Hawthorne Medical Centre in Levenshulme. She's interested in improving access to your GP, tackling the social determinants of health, and the environmental effect on health. Sinead recently made a video on how air pollution affects health, where she cycled on her commute along the Fallowfield Loop and recorded the air quality using a handheld monitor. Lots of you might have seen that video. Near to a local school, the monitor was well over recommended limits, which will be directly affecting the health and development of young lungs. Sinead sees the impact of climate change in her clinic every single day, and we're really excited to hear from her. So I'm going to hand straight over to you, Sinead, and I'll stop the share.
Great, thanks, Hannah. I'm just going to share my screen. Just tell me if you can't see it. So I don't need to introduce myself again. I'm a relatively new GP, but I've had an interest in the environment and the effect on health for a while. So I'd like to talk to you tonight specifically about air quality and its effect on health. This is the video that I made in the summer. I was asked to do that by the Whalley Range Climate Action Group. They also put me in touch with St. Margaret's Primary School, who I helped to make their own video. Those children were measuring the air quality index outside the school gates at prime times of the day. And they were finding that at prime time, at drop-off time, at pick-up time, it was in excess of 300 most days. Just to put that in perspective, anything higher than 50 is not good. And higher than 300 is hazardous to anybody. I'd like to start by sharing some statistics and some sort of home truths which shocked me. Air pollution in Manchester contributes to 1,200 deaths a year. It's 24 a week. In the UK, it's roughly equivalent to between 28 and 36,000 deaths a year. 80% of this is likely to be related to traffic fumes. There is evidence that the process of normal lung function growth in children is suppressed by long-term exposure to air pollution. And 60% of the pollution that children breathe each day is taken in during the school run. These are the different ways of emitting air pollution, sort of air travel, farming, construction industry, other industrial processes, within the home, solid fuel burning, the rail network, the road transport. But within Greater Manchester, the traffic fumes are the worst kind of contributors to air pollution. Traffic fumes contain 3 types of air pollutants. I don't want to bore you too much with all this. I'm sure a lot of you know this already. But one of them is particulate matter. These are tiny carbon molecules which are released in combustion. So traffic fumes is a big one, but also burning fuel in your own home also contributes to particulate matter. You can see that it's tiny. They are tiny, tiny molecules, smaller than the width of a human hair. The second one is nitrogen dioxide. It's a kind of an irritant gas. It's released, for about 50% of nitrogen dioxide in the air is released in traffic fumes. And that's higher in areas where there's more traffic. It's bad for things like asthma. It really irritates asthma. And then there's volatile organic compounds, which are released in traffic fumes, but also found in lots of sort of DIY equipment and paint. And because they're so volatile, once they're in the air, they travel great distances and can affect people much further away than you. So how do these affect health? Particulate matter 10, they're the biggest ones. They cause kind of eye irritation and rhinitis, which is nasal congestion. So most of us will have experienced that if you're around a lot of traffic. Your eyes burn, your nose is irritated. It's much worse for people who are kind of prone to that kind of problem. Then you've got the PM 2.5 and 1. These are the much smaller particles. They penetrate down into the lungs. They cause asthma, bronchitis, pneumonia. They don't cause COPD, but people who have COPD will have more exacerbations every year, more hospital admissions, higher rate of death because of it. And it's actually, you know, air pollution, not just particulate matter, but other gases within air pollution have been found to be directly carcinogenic. So they actually cause lung cancer. There are people dying from lung cancer in Manchester who probably wouldn't if they lived somewhere with lower emissions. And then the tiniest particles, PM 0.1, ultrafine particles. They penetrate right down into the small sacs within the lungs, and they cross over the blood barrier into the blood vessels. That means the lungs' defenses have failed, and it's got through into the bloodstream. Once they're into the bloodstream, they can go pretty much anywhere in the body, and they cause this range of health problems. There's less evidence for these than there are for kind of respiratory issues, but there is emerging evidence that it causes things like dementia and type 2 diabetes. So this is all quite depressing. I think it's more difficult for people to take seriously because it's an invisible and largely silent threat. So what can be done? Well, in August 2017, the Department of Health and Social Care requested that Public Health England undertake a review of the evidence to find effective and cost-effective air quality interventions that would provide practical recommendations for actions to improve air quality. They advise that strategies first focus on preventing air pollution in the first place. So I'm not going to go through them all right now, but you can see that this is all, you know, about preventing the emissions in the first place. So switching people over to electric cars, for example, would be one. The next sort of thing to do would be to mitigate the effects, reduce the exposure, try and keep the sources of pollution away from people. So that might be redirecting traffic or creating zones around schools where there's less traffic. And then the third thing would be to try and take less polluted routes and reduce the time spent in those places. The Met Office actually have an air pollution forecast, which you can look at each day if you wanted to really try and avoid those hotspots. One of the things that will become more of a focus in the last few years is a focus on health inequalities. COVID really highlighted the differences, the inequality of people's experience of lockdown, for example, and actually the inequality of the effect that COVID has on people's health is often determined by the level of deprivation a person suffers. Now, the first thing to say is that reducing air pollution will actually reduce health inequality. DEFRA has identified that the most deprived areas of the UK, mostly urban, and Manchester comes into that, were primarily located in urban areas and tended to have the highest levels of standard air pollutants. So these are the people who are most deprived, are actually exposed to the most air pollution and will have the most health effects because of it. So if we could tackle that, we will be reducing inequality, but we need to be very careful that we don't widen that gap that already exists. So those people whose livelihoods depend on driving, but who don't actually have access to the money to change their car to an electric car, they're going to be much worse off if we try and implement schemes like the Clean Air Zone. So we need to be a bit careful about that. We need to make sure that there is some provision made for those people to try and help them make the best choice. These were the things that Public Health England came up with. One of the things I'd like to draw your attention to here is that they've actually commented on whether a scheme would improve inequities. So you can see that subsidising public transport and provision of school buses would actually improve inequalities. So that's something that definitely needs to be considered. And the other thing I want to draw your attention to is the co-benefits, the green bar. So things like promoting walking and cycling have beneficial effects on other areas of health, like mental health, weight loss, cardiovascular health. So these are all things that need to be considered. They actually, if you look at the full report, they looked at hundreds of different interventions, and these are the ones they picked out as the most effective and the least harmful. And then these are the kind of road implementation ones which were most useful. And you can see that actually co-implementation of various measures, so taking into account lots of different things at once is going to be more effective than just doing one thing at a time. This is about changing behaviour, and these are the things that we need to focus on in terms of public engagement, the things that work, the things that are most feasible. So what I want to say really is, you know, what I have to ask myself when I'm thinking about behavioural change, and what I invite you all to do now, is to think, what would get me out of my car? We live in an age of convenience. You know, it's very easy for me to order anything I want. All I have to do is get on the internet and order some food. It will be here in like half an hour. It's crazy how easy everything is for people, but that's what we want. And I don't think it's necessarily a bad thing. I don't want to make people's lives more difficult. And I think that if we want people to take up cleaner air action plans and change their behaviour, we need to make it convenient for them. It needs to be cheaper. I came home from town last week with my sister. It was cheaper and quicker for us to get an Uber together than it was to walk to a bus station and get a bus. And that's the reality of the situation. The last thing is caring. We need people to care. And I'm surprised a lot by how many people I know who don't actually know the awful statistics and the real health impact that poor air pollution is having. This is Ella Kissy Deborah. She is a 9-year-old girl who died from an asthma attack in London a few years ago. And she's not the only child to have died from an asthma attack that was contributed to by air pollution, but she is the first person ever to have it put on her death certificate. And that's a good reason for everybody to care about changing their behaviour. Everyone's got their own kind of motivations. My motivations, you know, I care about my patients, I care about my neighbours, but I mean, most of all, I care about my son. This is Rodri, he's 2.5. And, you know, I have to think, you know, every day he is growing up in a place where I know that his lung function is going to be worse as an adult because we've grown up in Manchester. And if we move to the country, his lung function would probably be better, reducing his chances of developing other lung diseases later in life. As if we all need more parent guilt, but this is a big motivation for me. And is the answer to move to the country? Is the answer for everybody in Manchester to leave? I don't think that's going to work. So we need to come up with solutions here, and we need to act now. I'll take any questions now or at the end if you want, Hannah.
I think at the end is best, but that was amazing, very moving. You've done well to do both the science and the moving so eloquently in one single swoop. We're going to hand straight over to someone else to talk about air pollution, which is local air activist and mum, Ruth Todhunter. If you're okay with that, Ruth, we can pass to someone else if you need. So for the last few years, For the last few years, Ruth and her family have become frustrated with the increase of air pollution near their home in Longside. So along with a friend and a daughter and friend, she started measuring the air pollution in the area and found it was dangerously high. And since then, they've been campaigning to protect little lungs. So I'm going to hand it straight over to you and leave the rest up to you, Ruth.
Hi there. So we started measuring air pollution.
Ruth, we can't hear you, I'm afraid. Could you change the setting? Maybe? Any luck? Can you try changing the input? So if you go on the audio section. I'll try handing over to someone else, and we'll come back to you maybe. I'll give you some time to have a go in your settings. Great, so the person we're moving on to next is, it's totally thrown my scripting. What we wanted to make sure is that we weren't just talking about the healthcare system tonight, because that's not all there is to health. And one of the things that's really important to be talking about is the social care system and climate change. So with that in mind, the person we're going to hand over to instead is Sandra Daniels, our next speaker. Sandra's a disabled woman with a physical impairment who's a wheelchair user. She had a professional career working for a user-led self-advocacy project until the coalition government introduced the age of austerity, which resulted in the project becoming financially unsustainable. Since being made redundant, she continued to use her advocacy skills by supporting people to keep and access benefits, challenging social service decisions in relation to their care, and support to live independently, and offering peer support. Sandra has been an activist within the disabled people's movement for over 25 years, and last year was elected as the facilitator for Act for Inclusion, which is a national campaign. So we're not just Manchester now, we're looking kind of more nationally, that wants to replace the broken social care system and instead develop a co-produced, community-based system of support, which takes into account ecological and social impacts that impact on disabled people's lives. I'm so excited to hear from you, Sandra, so go ahead.
Oh, thank you for that. I'm just going to tell you a little bit more about Act for Inclusion. So Act for Inclusion evolved from being a campaigning group seeking to address the crisis within adult social care to one that seeks to place social care, social support in a wider context. To be able to live where and with whom one wants is a basic human right. Due to ageism and disablism, too often older and disabled people are institutionalised, disempowered, silenced and denied the support they require to live as community members. They are done to rather than being active participants within the decision-making process. Disabled people say nothing about us without us. So Act for Inclusion believes that by using a community-based eco-social approach to understanding the basics relationship between service users and their environments, it's possible to move away from traditional needs-led assessment processes towards addressing how to create inclusive participation in local communities and within wider society. Having support to make decisions, experiencing choice and control are all aspects of inclusive participation. Effective inclusivity enables individuals and communities to work together to build, shape and engage in decision-making processes through co-production and the development of confidence, skills and knowledge and experience. Act for Inclusion's campaigning approach contains 4 compounds, which I'll highlight in my speech as I go along. We also believe that neither climate justice or disability justice is achievable without the other. To put this into context, it's necessary for us to place disabled people's struggle for emancipation as a focal point. At the recent Birmingham Global Day for Climate Justice, I explained there remains a need to talk of injustices caused by climate change and potential injustices due to the lack of inclusivity within the climate change movement towards disabled people of all ages. So this Lattice MacLeod, an American activist, made a similar point when he wrote, "For social ecologists to be in solidarity with the disability community, they must consider disability justice principles in a transition from capitalism. Social ecologists also need to include the disabled community more in their organising strategies and making changes to ensure this goal is achieved." So the need to call out injustices. Climate injustice stems from how climate change is and will be experienced differently by specific groups of people and how their lives will be disproportionately impacted on by the worsening of climate change and if they are forgotten and not valued. These impacts are determined by a mix of social, economics, environmental and cultural factors, as well as discriminatory institutional practice. It needs to be acknowledged that climate change movements often fail to consider or include disabled people in conversations about climate change, the risk involved, and how we can transform societies. This lack of involvement contributes to the continued marginalisation of disabled people of all ages within society. So their lack of voice and engagement reinforces the oppressive view that disabled people are simply made vulnerable due to their bodies and minds, when in reality, the cause behind our vulnerability is the oppressive ways we are seen and treated. Climate justice is impossible without addressing the disabling barriers and social restrictions imposed upon us. So the disability justice principles of collective access. The principles of collective access is not simply about ensuring physical access into buildings or transport, nor is it just about developing inclusivity practice either. Collective access has to be created by recognising the inequalities that exist in power relations, the fact that diverse groups of people are impacted upon by normative values and oppressive practices. Inclusivity practice requires addressing intersectional issues, managing conflicts of need and interest, as well as drawing on creative imagination and experience of different groups of people. So drawing from natural ecosystems are defined as the network of interaction amongst organisms and between organisms and their environment. It is impossible to interconnect with social environments and therefore pay explicit attention to the social, institutional and cultural contexts of disabled people's environments. Ordinary lifestyles are interdependent. What happens in households, streets, communities, cities, and the planet impacts upon all of us. The COVID-19 pandemic taught us this in stark terms. In order to remove disabling barriers and social restrictions, we need to address all systems that impact upon human existence. We cannot address one crisis in isolation. Social support needs to be viewed in terms of the need to address climate change and sustainability at the same time. This is why Act for Inclusion has presented a vision and strategy for developing a new eco-social approach to replacing social care, which recognises the need to adopt an inclusive way of providing health, personal and social support within the context of developing sustainable communities. So no one should be left behind. So Latif said, social ecology and decision-making also needs to include the disabled community more in their organising strategies. Too often, their strategies not only exclude disabled people, there is also a promotion of body fascism culture where it is seen as a crime not to walk or cycle. And to own a car is a real no-no. So without access and appropriate transportation, older and disabled people are trapped and imprisoned and face a form of apartheid. The handling of the pandemic has made perfectly clear that the callous disregard there is for disabled and older people in residential care and for those living in their own homes. The lack of PPE and the death rate that was witnessed brought into public debate the fact that disabled people of all ages are not valued and so are not a priority when it comes to planning emergency measures to save lives. We must ensure the issue of climate justice and social justice are understood as interconnected. Thank you.
Thank you, Sandra. That was amazing. That was such a good summing up of all of those things. I actually got a little hint beforehand, but it's just wonderful. So we'll try and pass back to Ruth if you're. It looks like you've changed location. Maybe you've worked.
Changed my location. Can you hear me now?
Yes, that's perfect.
Yay.
Amazing.
Hi. So yeah, I was measuring air pollution with the help of the British Lung Foundation. We had a really fancy monitor. And I think it was one of the first ones that they'd had. And at first I was like, I had it in a buggy and I was pushing it around the streets and trying to work out how to measure it, how to work it, how to make best use of it. So I had it on the A6 and It was during the pandemic, so it wasn't as busy, but actually the levels of pollution were still really high and over the legal limits, even during the pandemic, quite early on, I think. Then there was going to be this active neighbourhood in our area, and I had heard that there was going to be bus gate on a road really near to us, which is where my daughter's school was, and so I thought it would be really interesting to measure the pollution before it went in and then after it went in. Unfortunately, Longsight councillors possibly blocked it. That's what I've heard. I don't know if it's true. So we never actually got the measures that we hoped to get in that area, but it did mean that I'd already got the monitor up at in the school playground. So then I could see what it was actually like, and I was so shocked that it was actually higher than on the A6, because it's right next to Crookoff Park, and behind that is Knutsford Vale. So I thought my daughter was at a school. I was thinking about pollution for a long time, so I thought I'd chosen a school that was like in a green area. Oh, like I know it's near main roads, but I thought it might be slightly protected. Yeah, I was utterly shocked at the levels I was seeing on the monitor. It was picking up particle matter. I was going to talk a lot about all the stuff that Sinead talked about, so that's really helpful. She's helped me there. So it picks up particle matter as well as the NO2, and the particle matter was really, really scary, the levels that we were seeing. And also the levels always were over the legal limits. And yeah, obviously they were worse at kind of commuting time. And some people from the Lung Foundation were like, why is it so bad there? So then I had to look at the road, like, why is it so bad in this particular location? And I realized a lot of traffic uses that road to miss the traffic lights on the main road. So even though it is a smaller road, it's actually used as a cut through to get into town and to other roads. Yeah, and it's also on a bend, so cars stop and then accelerate. So where the nursery playground is where they accelerate. There's also a bus stop right outside the playground, and I have become really obsessed with buses idling, because they're often diesel, and there's a lot of on those kind of routes, there's often older buses, and they might have their engines on for 10 minutes, and I could actually look at the monitor and I could work out the times of the buses, and I could see when it peaked. So I've been kind of writing to Stagecoach, asking like whether they can really ask the drivers to turn their engines off every time I'm on a bus. When they are idling their engines, I will write a complaint, and then they want to know exactly what time it is. But really, like, there needs to be more initiatives to stop this kind of behaviour, because often there are bus stops outside doctors' surgeries, schools, nurseries. And if the pollution isn't bad enough anyway, then you've got that extra time when those engines are just running, and obviously they're not burning the pollution is even worse when they're idling. And I've just basically become really obsessed with it, which it's kind of taken over my life slightly. And one of my daughter's best friends has got a really serious lung condition, and was having to go to hospital like really, really often, and staying overnight, really difficult breathing difficulties. And so Jess, my daughter, and her friend, they're all 9. They all got really interested in this monitor and what it was doing and what it was measuring, and they were really worried about their friends. So they started making a song up about pollution to try and they wanted other people to know about these things. And so they got really kind of active in kind of making little videos and sharing them. We were invited to COP to go and talk on their stand to people that were coming to see what the British Lung Foundation were doing in terms of pollution. And what else have we done? I don't know, I've really changed what I was going to say, because Sinead covered so much of what I was going to talk about, which was really good. What else have we been doing? Just trying to educate people. But yeah, right, they've made like a video to Andy Burnham saying, you know, what are you going to do? What are you doing to help children like me with asthma? Like Lillian asked a question before the election directly to Andy Burnham on ITV, saying, I've got severe asthma, what are you going to do for children like me? And he didn't answer the question. So from then, and that was like a while ago, we were quite discouraged by any hope for Manchester getting any cleaner. Yeah, and feel pretty depressed about what's going on now with 2026 is a long way away. These kids that are 9 are going to be 14. Elikisa Deborah was 9 when she died. She would have been 18 this week. You know, all those other children that might have asthma attacks in that period of time until 2026. Yeah, I just think that we need to act now. Like, what hope have we got for climate change if we can't sort out our air pollution in our cities? Manchester, I read that North Manchester had the highest emergency for asthma, like emergency cases for asthma in the UK. Like, why are we not worried about this? Why is this not urgent? Like, in the same way that with COVID, you know, there was this action. Yeah, because this is an invisible threat, it seems like it's quite easy to kind of just bury it and not think about it. Yeah, I don't know. I think that's probably about all I've got to say for now.
That was wonderful, Ruth, really moving. And your passion really comes across there. Just before we move on to the next speaker, just a quick reminder that, like, it'd be great if people start posting things like questions and stuff in the chat as you're going along. It doesn't have to be for everyone. We've obviously prepared quite a broad range of people here, so it might be a bit tough to think of the one question that fits everyone. So just kind of whoever you'd like to direct that to, that'd be great. And we'll keep going. So the next person we've got is the awesome vegan chef, Ngwafu Tansie. Ngwafu is the founder of her own business, Ngwafu Vegan, which brings these amazing looking vegan West African cuisine to a food market near you. I would highly recommend checking out Instagram, unless you're having dinner after this, in which case it might just make you too hungry, so maybe don't. Ngwafu is also a community cooking leader for Cracking Good Food. If you've not heard of them, Cracking Good Food's mission is to work collaboratively with others to eradicate food poverty and increase food sustainability in Greater Manchester. So as a cooking leader, Ngwafu teaches the community how to cook West African cuisine and does community outreach projects. Over to you.
Hello, thank you. Yes, I guess I don't have to reintroduce myself. But yes, I'm a vegan chef, and I'll start with Cracking Good Food. Within that, it's a social enterprise that empowers the neighbour communities to cook good, affordable food from scratch, using local and seasonal produce. And within the social enterprise, they campaign against food waste and many causes of climate change. They also fight for social injustice, having a living wage for everybody, good food for all, and sourcing food locally and giving back to the economy. I believe that everybody deserves good food, and everybody should have access to food in general. So what's currently happening what I see within Manchester is there's a high influx of people who are changing their diet, either be vegan, vegetarian, or meat reducers in general. And within this community, especially for the upcoming years, we're seeing an increase of children and elderly people adapting to this lifestyle, as well as ages between 18 and 65. And what I find is people within these communities, they want more information and further education around the subject. In this case, it would be something, so in this case, it can be something that can be picked up within school meals, their education, social home, and assisted living. This can be done by passing general consensus around the subject and educating people around food poverty and how climate change is affecting food in general. I see this through, I currently work within a cafe within Withington, which is within an assisted living home. And I come across a lot of elderly people asking me about my journey with the vegan diet and why it's so important to change your diet and reduce meat consumption and dairy consumption. And I showcase that through trying to cook as many vegan and vegetarian foods within that community, so they can understand that if you eat within this diet, you're also getting your nutrients, as well as you're feeling full, you not feel like you're missing anything, because that's a big consensus about meat reducing. Sorry, just looking at my notes. Another thing that we need to do is increase the knowledge of how changing your diet can influence your health, while simultaneously bettering the planet and changing the landscape within the food industry. This is a large ethos within my business. I ensure to continue to educate people about how it is a win-win scenario. Nobody loses in this scenario. By reducing your meat, you're saving the planet, you're bettering your health, and you're feeding into a sustainable future and reducing climate change. Also pushing it forward that you're not missing out on anything, you're getting your nutrition and you're getting a balanced diet. And doing this in a positive way. So I also think it's very important that we shouldn't shame or bash people who can't necessarily fit within that diet. So not everybody can be vegan, not everybody can be vegetarian. You might have personal reasons why you can't do that. There's some people who generally can't maybe afford to, or don't have the education around it. So it's very important to ensure that, yes, not everybody can be able to, but at least everyone can do their bit to be able to push for it, whether if it's doing it once a week, whether if it's send a letter to your schools to make sure they increase more vegetables and source more locally based ingredients, making sure to use local suppliers, educating their chefs and the teachers to ensure that this is happening. So changes like that within the food industry is also vital, as well as the food itself. So what will happen if the climate change worsens? So if it worsens, we have to, again, continue to further educate, because telling people that within the food industry, stuff like drought and floods can seriously affect yields of food. So if UK is one of the countries that heavily relies on imports, and we are seeing within Europe, Asia and South African regions, you're getting high levels of drought and floods, which reduces the yields. What happens is increased demand for food, and when that happens, the price of food increases, which would then, so if you go to your local supermarket or grocery store, you can see that food is really expensive now because of climate change, which then marginalizes people. So people who could possibly afford to probably buy more fruit and veg for their kids or themselves to eat can't do so anymore. So they're relying on fast food and junk food, which is not great for anybody's health or the environment. So what the government can do to do that is subsidize local farmers, local businesses, and encourage more people to feed back into the communities and support local as much as possible. So the pandemic has certainly highlighted this, with large communities getting priced out of food, food banks communities picking up what the government should be doing. So we saw a high increase of food poverty. As everybody knows about Marcus Rashford and what he did, for schools and meals, which the government didn't do themselves. I've personally done this, and I've made sure that I do this as well. I've helped people eat more healthy on a budget, educating them on how they can do so. More and more people want to know, are having to do this, and as the cost of food continues to go up. So if we can educate people of how they can eat on a budget and where they can source these foods, and the government can also help people like Cracking Good Food and also another good company is Open Kitchen, tell people where they can get this, how they can do this, then more and more people will get into it. So what actions can be taken place to move forward could be action at a local and regional level is vital and important to help reduce the risk. They can help local businesses, farmers, retail outlets by education, financial support, and awareness to ensure everyone gets fed while keeping the costs down. Supportive social structures. This may mean training for committee members on issues related to climate change and adaptation. I've seen many people on committees and within the government don't fully understand climate change and how it affects the food industry, so that needs to change. Partnership working. So working and networking with key charities and social enterprises like Cracking Good Food and Open Kitchen as examples, who are already doing some important work by increasing their reach and helping them. So increase the funding, increase the awareness, and get volunteers and more people involved to help tackle climate change within the food industry. Community-led planning, so setting up community hubs and meetings within areas to help identify the risks around climate change and what is happening at the moment within areas following this. So just as other points that have been aware, if committees were set up so people, or even like Zoom meetings like this, people can come to and highlight the importance. They can see what's happening on the ground and they can take action, which is the following point, is setting an action plan group to implement these and get the community to be involved. So if all these points get involved within any of the industries within climate change, I really do feel like we'll see a change.
That's amazing. And what a nice note to end on. We get to see that change.
Yep.
We're down to the kind of final straight now. So we're moving from food to our final one of our wide range of subjects, and that's mental health. Our next speaker is Rasha Alkoly. Rasha's a mental health PhD student at the University of Manchester. She's a general practitioner and clinical lecturer at Cairo University, Egypt. Because of her special interest in mental health, Rasha came to the UK in 2017 to do an MSc in global mental health. And she's currently doing a PhD and is passionate about mental health in older adults. So often when we talk about the effects of climate change, we're talking about, on mental health, we're talking about young people, which is really important, but it leaves a lot of people out of that conversation. So we're really excited to have Rasha here to open to that wider chat. Over to you, Rasha.
Thank you so much, and thank you for introducing me. Is it okay if I share the screen? Can everyone see the screen? Is it? So thank you very much for having me today. Thank you so much. So today I'm talking about the understanding anxiety in older adults from diverse cultural backgrounds. This is a study I'm working on. It's part of my PhD thesis, and it's funded by the University of Manchester. First of all, I would like to, sorry, I don't know why it's not working. So sorry about that. Oh. So first of all, I would like to thank all the participants who have taken part in the study so far, and it has been an honor to interview them. I would like to thank the research team, the great supervisors, and the awesome group of public contributors I've been working on throughout the study. And a special thank you to all the organizations that have helped me and continue to help me in participant recruitment. And during today's talk, I'm hoping to talk a little bit about why the study is important, and just to some of the ideas that have been emerging from the study, and then to wrap up the presentation. So first of all, why is studying anxiety in older adults such an important topic? Well, because worldwide the population is actually aging. 1 in 6 people will be 65 years or older by 2050. And in Europe, this figure is even higher. It's 1 in 4 people will be 65 years or over by 2050. And, you know, it is really important to note that older adults are an exceptional population of people, and they make important contributions to the society as family members, as volunteers, as active participants in the workforce. They have a wealth of experience and are a force to be reckoned with. And it is their basic right to have good physical and mental health. But unfortunately, due to the negative stereotypes associated with aging, things that you most probably have heard of, things like forgetfulness and anxiety and depression, are normal aging processes, which is completely untrue. Because of these negative stereotypes, you know, older people with mental disorders tend to be underdiagnosed and undertreated. And one of the most common mental disorders in older age is, of course, anxiety. Anxiety has been labeled the silent giant because it has been for several years overshadowed by the other giants, dementia and depression, in both the clinical and research fields. And unfortunately, there is this kind of traditional view that anxiety disorders are just mild, non-disabling disorders, while actually the opposite is quite true. Research has shown that anxiety disorders are associated with a reduction in a person's quality of life, and they increase the risk of medical problems, the risk of mental problems, even the risk of mortality. And the bigger problem is that there is this large body of evidence that shows that older adults, in comparison to younger adults, tend to underutilize mental health services. And people with anxiety, in comparison to people with other mental disorders, are also at a higher risk of not using mental health services. So you can see that it's kind of a double impact. Older adults with anxiety are at a particularly high risk of not using mental health services. And the question is, why aren't they using these services? Well, that's a very good question that we still don't have an answer to. And you know, one set of factors that may give us some insight into why some people with anxiety may seek medical advice while others may not are health beliefs. So researchers studying health service utilization in physical health problems, so mainly physical health problems, have shown that the way we understand our illness affects the way we cope with these illnesses and our help-seeking behavior. So just to give you a simple example, so let's say that an hour before the presentation, I started having this kind of headache. I will start going through a journey, a thinking process to kind of analyze what is causing this headache and to take the appropriate action. So I actually believe that this headache is because I'm stressed. I have a presentation in front of such a lovely audience, so I'm a bit stressed. And I don't believe that it's going to last forever. It's most probably going to last for half an hour maximum. It's not devastating, it's just a mild headache. And based on this analysis, I don't think that I need to talk to my GP. I would rather take a painkiller. And after taking the painkiller, I'll wait for 30 minutes. And if I'm pain-free, that's great. My analysis worked, my framework worked. If not, I will just reevaluate the whole situation again. So as you can see from this diagram, the way we understand our health problems, our illnesses, does actually affect the way we cope with these illnesses. And when speaking about mental disorders, there is this extra layer of complexity. It is culture. Culture has an important role on mental disorders. It shapes and paints the way we express, the way we experience our mental problems, who we seek help from and when we decide to seek help. And this is exactly what I'm trying to do with this study. The Understanding Anxiety in Older Adults, the aim is to understand how older people from different cultural backgrounds understand anxiety and how their understanding of anxiety affects their selection of coping strategies. And hopefully this study will help us understand how to improve the health services and make them more suitable and acceptable to older people with anxiety. I'm still in the data collection phase, so I haven't reached data findings yet, unfortunately, but I would like to share with you some emerging ideas that I find quite interesting. So one of these is the ambiguous nature of anxiety. While talking with the participants, there's kind of this wide range of symptoms that they have attributed to anxiety, ranging from very mild symptoms to severe symptoms to very specific anxieties. And there are also a wide range of causes, with some participants believing that it's a normal part of aging, others believing that it's a weakness in their personality. Some believe that it's actually their personality, it's their identity. And on the other hand, some actually believing that it's the work of the devil. Some believing that it's caused by social problems, medical problems. So it's kind of this really ambiguous idea about what anxiety is. It was really clear that depression is much more recognizable as a mental disorder than anxiety among participants from all cultures. And more interestingly, one of the ideas that have been emerging is that the thought process underlying our choice of coping strategy is very complex. It's not just based on how we understand an illness. It's actually based on how we identify ourselves. It's kind of the self-identity. It is related to higher goals, things like self-esteem, with people who value their self-esteem not willing to disclose anxiety because they believe that it's a weakness. And they don't believe that it exists. So I'm still in the process. Hopefully I'll get there. So as a wrap up, anxiety disorders are very common among older adults. Left untreated, they cause several negative problems. This study hopes to understand how older people understand anxiety and how they cope with anxiety. I apologize if my study doesn't focus on the interaction between mental health and climate, but I hope that the study findings will show me something interesting related to the environment and climate as well. Thank you very much for having me. Thank you.
Oh, thanks so much, Rasha. I'm picking up the baton for Hannah for this next section, but one reason we were so pleased to have you speak is that more broadly, and it seems in the work that's done in Manchester in particular, there is a focus just on the effects of young people's mental health and climate change, which, although really important, is clearly only part of the picture. And there's also often an assumption that we don't have much evidence about mental health, perhaps drawing on only anecdotal evidence. So it's really important that we draw in people who do have other methodologies and evidence base. And yeah, I can't wait to see the findings of your study. So I hope you keep in touch with us on this. Okay, so we are now going to move over to the question section, open the floor to you all for about 20 minutes. In the interests of time and to save my eyes jumping around all the little screens, what we're going to do is put questions in the chat, and then I will ask them to the speakers. So we can ask them to just one or two speakers, or if you do have that grand question that might ask all of them, I'll do that. So there's been a few as we go along, but I'll just give you a couple of seconds just to put something in the chat, and then I'll kind of draw them out, bunching them together where appropriate. Okay, so first one that's come in and will also be picked up when we do our report summary. Well, there's two that come in similar, which is about what concretely do you think that Manchester City Council could do in the next 6 months in your area? So I'm going to perhaps ask all the speakers to make just one concrete suggestion. It might not be the extent of what you can do, but maybe just one thing that you think Manchester City Council could do in your area in the next 6 months. Shall we ask the speakers in the order that they came? So that will be Sinead, one thing that you think Manchester City Council could do in the next 6 months.
Oh, thanks for letting me go first. I'm going to choose the least important one now. It's really hard to think of what was the best thing they could do. Well, I thought the best thing they could do was the clean air zone, but as that's not going to happen for a while, probably harm reduction kind of schemes around schools. So some schools are doing this already, but I think they need to make it clear that every school needs to take part in this kind of activity. So things like having a marshal outside who'll move on vehicles that are idling, trying to do walk or cycle to school schemes where they'll park 10 minutes away from the school and then the children will be walked from that area, so that it reduces those massive hotspots around schools with regards to air pollution.
Great, thanks. I know I said in the order that the speakers would go, but I think it makes sense to ask Ruth now, as your ask will also be to do with air pollution. Ruth, what would...
Mine would actually be very similar, and I forgot to say that we also have a petition asking for school streets for every school in Manchester, and for it not to just be schools where parents are more active and vocal, that, you know, some of the poorest areas suffer with the worst pollution, so that that these are done fairly across the whole city. And I did actually speak in the Children's Scrutiny Committee and ask for this at the council meeting about 2 weeks ago. So yeah, that's one thing I'd be asking for. My second ask would be for fining people for idling. Just in the middle of town today, I saw 10 vehicles idling, like 2 men asleep in a van in the middle of town, just idling. Like everywhere I look, there was vans, cars idling. You know, they can fine people in the middle of town for dropping a bit of litter. I feel that pollution is worse than dropping litter in my yeah, in terms of how it affects people's health in the city. And yeah, that's the 2 things I would want the Manchester City Council to do immediately.
Excellent. And then I'm actually just going to go to Kaz, who answered a report, who I think has an answer to this question as well. She's been working on this area.
So I'm representing a few different groups, particularly working in Whalley Range around climate action and more walking, riding, less driving, working on a sort of clean air plan for Whalley Range. But one of the things we've been looking at is what is our ask to the council and to the wider kind of GMCA. So I think my asks would be similar around the schools, and that I'm not sure that they can make everything a permanent school street, because I think there's an element of behaviour change that also needs to be encouraged. So, but it is really helpful. I think what is important that the council does, so the new powers around traffic offences for moving vehicles are coming in 1st of June. The City Council must sign up to that so that they can start using something like AMPR to enforce traffic offences when they make somewhere a school zone. Because I think, I'm not sure who just mentioned it, but I think it was Sinead, which is that we cannot rely on parents and staff and other volunteers to have to manage school streets, because it creates inequalities where those parents aren't available. So that's my one ask, is that they take on these powers and they use them with cameras to enforce permanent school streets in as many places as possible. My other ask would be around encouraging active neighbourhoods. So I think the council needs to provide a much more overt, committed support and consistent communication and engagement around that whole vision of active travel and neighbourhoods, and empowering community groups and improve monitoring and evaluation of schemes, and not be shying away from saying that they're going to go ahead, and allowing the small minority of kind of those vocal car drivers to take over the argument. I could go on, but I'll let someone else speak. Oh, sorry, one more thing, that the council takes a much more, that they start to build into their policies, a much more proactive approach to development, so that any new developments put environmental, air pollution and traffic impact considerations at the front and centre of those developments, rather than just building new infrastructure and houses and buildings that are still centred around cars rather than walking and riding.
Great, thanks. And we've also got some other specific asks that people have in the chat, some around active neighbourhoods, also questions about who it is that you approach, and stories of being sent around in circles when asking about school runs, and long email responses. So I think on some of those links there'll be some more active asks. Just before we come back to the chat questions, let's continue asking speakers what they think could be done in their area. Next, I'm going to ask Sandra. Now, I don't usually make exceptions, but if you want your ask to be of councils and local authorities rather than just Manchester, given that you represent that wider area, I'll let you have that. If you've got one ask that sort of could be taken at the area of councils or local authorities for your area, Sandra.
Yeah, I mean, I think it's about, decision makers setting up co-production with disabled and elderly people, so that they can actually have a say within the environmental changes, and making sure that they're not left behind. As I said, I understand I'm an environmental campaigner, so I understand that transport and, driving and is really important, that we look at how we limit that for the pollution issues. But we have to look at having good accessible public transport. And so until we get that, then it's going to be impossible for disabled and elderly people to be able to get around. So what we'll do is we'll limit their movements, and they'll be forgotten, and they will become imprisoned in their own home. At the moment, the buses that we have, they're not actually accessible enough, really, because the buses in Birmingham, they only have one space for wheelchair users, which, that isn't enough, because that means that you can't travel with a friend who's a wheelchair user. And often, we can't get on the bus. So we have to look at alternative transport measures. And I think that's something that needs to be spoke about with disabled and elderly people. I don't know in Manchester whether that has been happening, whether co-production has. There is a group which are looking at inclusivity and co-production. That's something that obviously in Manchester, I think the Coalition of Manchester might be involved in, but I don't know. So if that's the area I would start to look at, and want councillors to start to look, working with people and set up some sort of group that looks at inclusivity and co-production and start discussing the big issues.
I think that's a really good point. And there are a couple of councillors as well as campaigners on this call. So if anybody does have any knowledge of those co-production approaches being used, of course, drop them in the chat. Just to continue the question of one concrete thing that Manchester City Council could do in your area in the next 6 months. Food was one of the areas where our report showed that there were good initiatives, but perhaps some of the biggest failings at an organisational level. So Ngwafu, can you think of one thing that Manchester City Council could do in the next 6 months in your area? Something, just one concrete thing.
Making availability or funding for organisations and individuals to go out and speak about food waste, and changing people's diets within with homes, schools, workforces, Zoom setups, and have people interact with that. So further education about that at a local level is necessary.
Great. Now, Rasha, from your work and experience, do you think there is something that Manchester City Council or at local authority level could happen in the next 6 months?
I believe that from the perspective of the participants that I've been interviewing, it's social prescription, especially gardening and befriending services, but especially things such as gardening, because people believe, the participants, most of them actually believe that accessing psychological therapies and medical advice has been extremely difficult, especially during COVID. And most of them prefer these modes of coping strategies where they meet other people. It's kind of dealing with isolation and loneliness at the same time and finding some people with similar interests to talk to. Thank you.
Great, thanks. That's really interesting. And I believe that social prescription is going to be discussed by a future health scrutiny committee. So if anybody else has interest, experience, work in this area, do get in touch with us, because it's likely to be something that we're also working on to see what's already happening and what needs to happen next in the area. Are there any more questions that anybody has for one speaker, multiple speakers? It's been great to see some of these links come through. I can see a question from a bit higher up from Sophie, which asks, it's particularly focused on the air pollution speakers, to ask if any of them have had success with working with employers who require driving from their workforce. She's in a situation where driving is required by her employer, but they're a charity working to the benefit of health and well-being of young people. So it's a question about employers for the two air pollution speakers. I don't know if you've had experience of that, Sinead or Ruth.
Sorry, I haven't had any experience of that.
In terms of if you have to drive for your job, I have had experience, because as a GP trainee, part of our contract is that you have to have a car or access to a car to do home visits. I got around that with my trainer, my GP trainer. It was actually did all of his home visits on a bike, so that's what I did. But it really depends where you work, and obviously that's not possible in the countryside where you cover a bigger area. But most inner city practices, you can do home visits on a bike. So yeah, I think it's difficult. I think it should be possible for everyone to do that. It really does depend on your job, though.
This is an interesting area. There is I've got another two questions. I'll take this one that's just come in, because that's also mentioning about Sinead, and it's around the price of fuel. The question is how we can kind of move things forward on this issue. So perhaps around retrofit. I don't know if any of the speakers want to look at that issue. Does anybody want to talk about air pollution and links to fuel retrofit?
One thing I would like to say about electric cars is that although they don't produce NO2, they do produce higher amounts of particle matter, which is the stuff that gets into our bloodstreams, so it's more dangerous. So really the answer is not for cars, in my opinion, that we need to increase public transport. I think public transport should be free for children like it is in London, more accessible. They need to have routes that, you know, like from where I live to get to one of the hospitals was like, just took forever. Yeah, it needs to be, accessible and affordable. And I don't have an opinion on but
that's okay. I'm just going to take one last question, which came in a little bit higher up, but I think is an excellent one. It's from Alison, and it was directed to Rasha. It was just asking Rasha if she had any early thoughts about some of the connections between climate change and anxiety, either from literature you read, other studies that you're aware of, or maybe even from your early work with the participant. Any early thoughts or even hypotheses about those connections?
Thank you for the question. So regarding the literature, anxiety in older adults, so regarding the literature on anxiety in older adults, it's kind of a very limited literature, but with respect to the interviews I've been conducting with participants, one thing that has been noticeable across the different cultural backgrounds is how people, interact with the environment, in terms of some of the participants feel that the environment is like talking with them as if it's the environment, and they described it in a very beautiful way. It's one of their coping strategies, one of their distraction methods, that they go walking. And of course, this has not been affected very much by COVID, because they used to go walking by themselves, even during this tighter restrictions. And they just feel that the environment is like talking to them in some sense. They can it helps them relieve the tensions and the anxieties. And this has been evident throughout, across the different cultural backgrounds. So some of the participants actually had a walking group where they would go walking 1 hour every day. Even the ones who found it difficult to walk would find their friends going on a walk and they would help them. But nothing very specific to climate change has come up in the interviews, unfortunately. No.
Mm-hmm. I think that's interesting, and perhaps confirms what we've seen, that this is a kind of emerging area where more evidence and more work is needed. Just before we hand back to Hannah for our final section, I just noticed that Sandra has her hand up. So as one of our speakers, you have the right to make an additional point.
Yeah, I wanted to make an additional point about anxiety and climate change for disabled people. So we've had the pandemic, as I said within my speech, is that the disregard that was shown for disabled and elderly people living in residential care, but also living in their homes, the lack of PPE. Obviously, we know the death rate was so massive within the care homes. It was reported on the news and so on. So I think with climate change, I think one of the big issues and anxiety for disabled people is that we've just seen the pandemic as a crisis, as a national emergency. They weren't, disabled and elderly people weren't considered. It wasn't thought through. That's why obviously we had the death rate we did. So it's about that in itself makes people very, very anxious. We know that the NHS has got massive issues in terms of funding. So therefore, if you become ill, about going to hospital and getting treated, we know that there's massive waiting lists for people who are waiting for procedures and operations. So often, disabled people are people who aren't valued, and they're the people that often aren't the people that will be treated. It'll be the younger people and people who are considered to be fit and be able to participate within society. That is a massive, massive, I think, stressful situation for disabled people to think that you won't be treated, and clearly to have been shown during the pandemic that actually you're not valued.
I think that's a really important point to make, and a good thought for us to keep with us as we wrap up. So just for our final stretch, I'm going to pass the baton back to Hannah.
Thank you. That's me catching the baton. That's how it works, right? You meant to catch it. Cool. So we once again have a little bit of interactivity. It's on the same Mentimeter link, but I'll just post it here and get all set up with sharing before I start talking, because I know I have a tendency to drift off halfway through a word. Great. So that's what we've had. That's what we had last time. You can see some of these like really important themes that we've talked about today kind of coming up. But we're moving on to the next slide of the Mentimeter. And that's, what does Manchester need to do next? Hopefully you'll all have got an email today that tells you that we've just released a report called Health in the Climate Crisis, what Manchester needs to do next. So we thought it would be a really good way to kind of cover this by doing this like little bit of interactivity. We thought it wouldn't make sense to cover all the recommendations at length here. They're all in the report, so just head over there if you want to read them. Instead, you know, like this is a nice chance for everyone to contribute and feed in whilst I summarise our reflections on some of our findings. We want that to be really broad, so you can respond with what individuals can do. You could say maybe what groups or communities, neighbourhoods can do, or what GMCA or Manchester City Council or national government can do to help Manchester get to where it needs to be. Tonight has been all about the voices and the experiences of people across Manchester and beyond, of course, Sandra. And we know that people need to be at the heart of what happens next. So that's the bits that we're going to focus on, those elements of the report. The report is a response to the health scrutiny report that will be discussed tomorrow. And we followed the same structure. We've looked at the same things. So that's climate change in Manchester and its effect on health, extreme weather events, air pollution, food, mental health, and healthcare systems and services. And it's obviously really tough to summarise across all of those really broad subjects. There are so many ways in which health can affect climate change. Climate change can affect health. You know, things like heat-related illnesses, parasites, mental health impacts. It's really broad. And when you're looking at health, it's more important than ever to be looking at both mitigation and adaptation. The NHS alone makes up 5 to 6% of the UK's emissions, and that's really important to know. But also getting adaptation right is about protecting the most vulnerable people in society and reducing those health inequalities. And the thing about it is there are loads of opportunities here to do better and to make real change. I just want to pull out one of the areas we looked at because it exemplifies that need for more urgent action, and that's food. Manchester's food system is being pushed to breaking point. In just 2 years, from 2019 to 2021, the number of emergency food parcels distributed across Greater Manchester increased by nearly a third. Food prices are rising because of the cost of living crisis, which is pricing people out of sustainable, healthy, nutritious food. And GMCA and Manchester City Council have committed to a lot of wider national schemes around access to sustainable food. Things like the Right to Food campaign, the No Child Should Go Hungry campaign, and most recently, the Glasgow Food and Climate Declaration. But the thing is, we don't know how we're going to get there. So if we made a roadmap and we successfully implemented those schemes, it could be totally transformative. But we still don't even have a Manchester food strategy in place. So we can't scrutinise that food strategy. We don't know how to get to where we clearly need to be. And that kind of shows us that there's a bigger point here, something that we came across over and over again in our report, and that's a point of delay. Last month, for the Environment and Climate Change Scrutiny Committee, a public health consultant said that we lost a decade on food system reform in Manchester. I've got the quote here. There had been a food board. There'd been a lot of work done on this 10 years ago, but we lost posts and work through the cuts to the council and the impact of austerity. We want the work to be happening right now. We need it to be happening right now. It would be really great if we were way beyond an introduction to climate change and health. But we're not, and it's been a really hard decade and a hard 2 years for the health and social care system. But it's also really, really urgent that we tackle climate change. The health impacts are already there and they're definitely getting worse, and we really can't afford to lose another decade. So what we've done in the report is we've offered suggestions for where further work is urgently needed across the whole strategy, to develop strategies and implement them, to actually embed climate change into the Health Scrutiny Committee, to scrutinise and improve climate action plans, support vulnerable people, end health inequalities, and show some real leadership. As if that's not enough of a work plan, we're also saying that the work's not easy, and we've seen from the Clean Air Zone what happens when you don't engage people from across the city. We need to engage and involve people to find the solutions that actually work. I've been watching the health scrutiny meetings for a year. I need a new hobby maybe. And I've seen the work on COVID health equity sounding boards and trusted messenger work, and the way that we talk about people who are vaccine curious and try and engage them. And that's another reason why it's important that the Health Scrutiny Committee be looking at climate change. The expertise and the networks are increasingly there to make the change. We're learning lessons and we need to start implementing them. So I'm going to kind of wrap up and leave it with the same nod to the future as the report. If you make it through all the pages, you can read this in the back one. Our front and back page of the report, the picture on the screen here, is made from vinyl offcuts, which we freehand into abstract shapes during a climate emergency Manchester meeting. It's just something to do with our hands, but what it is it's visible proof of our collaboration, of sitting down and doing the work together and trying to find a new solution. So that's what that's meant to represent. And the back cover is an empty frame. The intention is that that empty frame suggests a place for policies, answers and ideas to respond to the questions that we've posed in this report and this event. And we really hope that you fill it. This is also just the start of this work. It's not our last say in the matter. We've only just started. So we'd love to hear from anyone with any suggestions about how we can take it further or who'd like to get involved. There's some really great ideas kind of scrolling past me, which I'm not really having time to read, but I hope everyone else is enjoying them. And that's it for today. If, as we've gathered so many great people who are doing really interesting work in lots of different places, I'd really recommend, I want to open the chat up so that everyone can post any plugs to your projects or groups in the chat box. It's so nice to be having this moment to collaborate. I'd also just like to say thanks again to all the speakers for generously giving their time and all of you for giving up a Tuesday afternoon. It's been a lovely evening. I think I'm going to sleep well tonight. My mouth is so dry from nerves, but it's been a delight. So thank you so much to everyone. And now there's a bit where I kind of awkwardly fill time so that people have time to post their plugs. And yeah, thank you so much, everyone. I'm realizing now I should have offered people to open. You can also unmute and do a quick plug if you've got a short one. Save me doing my the thing about airport food. I don't have the follow-up. I don't know how the joke goes. I don't think anyone realizes there's someone in this, and they'll remain nameless. There is a comedian amongst us, and I shan't be immediately asking them to do a type 5. But yeah. All right. I think that's the plugs are slowing down. We're moving into teasing me about my patter, so I'm gonna end the call. Thank you again to everyone. It's been really great. Oh yes, I'll give everyone a moment to save the chat as well. Okay.
Thank you very much.
Great evening.
Thank you. Bye.
Thank you. Bye.